And talking about our immune system, our next presenter is Dr. Sabine Hazan. She's been practicing gastroenterologist for the last 3 decades while concurrently conducting over 200 clinical trials for pharmaceutical companies, including vaccine studies. Her research genetic sequencing lab is spearheading the study of the gut microbiome and is linked to several diseases with 57 clinical trials. Dr. Hazan.
Thank you, Senator. It's an honor to be here. The microbiome, our microbes in our guts, is our immunity and tells the story and will tell the story of COVID-19. And this is why, as a gastroenterologist, I stepped into the pandemic. Through my experience, I will show you how difficult it was to conduct research and publish when the research goes against the national public health narrative. Interference and delay in research happened and affects all of us. In early 2020, my research genetic sequencing laboratory was the first lab to document the entire sequence of the virus in the stools, as opposed to the PCR, which is just a little piece of the virus. We discovered that the virus lingered in the stools for up to 45 days. It took 6 months to publish this publication at a time where everybody needed to know that it was in your stools. My lab also showed that COVID-19 in the stools was killed by hydroxychloroquine and azithromycin. But unfortunately, azithromycin and hydroxychloroquine killed the microbiome. So therefore, vitamin C, D, and zinc was added. 3 protocols were submitted to the FDA from our findings. 3 studies were also put into clinicaltrials.gov in full transparency to help doctors more effectively treat COVID, because I knew data that nobody knew. April 2nd, 2020, FDA gave us an exempt letter for doing a clinical trial. In other words, we did not need to do a clinical trial on hydroxychloroquine, Z-Pak, vitamin C, D, and zinc as treatment, or hydroxychloroquine, vitamin C, D, and zinc as prophylaxis. April 4th, somebody must have called the FDA and said, I got another letter saying, I'm sorry, Dr. Hazan, exemption is denied. You must do a full-on clinical trial. Here's the letter. System pressures delayed us, and we got a green light to start recruiting by May 2020. By then, the media created fear around hydroxychloroquine. It was impossible to recruit. This drug was safely given for years for arthritis and lupus with no problems. My clinical trials companies were also banned and censored from advertising on Facebook, Instagram, and Twitter. Remember, I do clinical trials for a living, and never, as a clinical trial doctor, have I not been able to advertise to recruit for a trial on social media. I kept collecting stools of patients and noticed that patients with severe COVID had a certain bacteria that was missing compared to people that were highly exposed to COVID but never got COVID. That bacteria is called bifidobacteria. Bifidobacteria is an important and key microbe for immunity. It represents your trillion-dollar industry of probiotics. In fact, when you turn the bottle and you see the ingredient, it says bifidobacteria. It is present in newborns. This is why your newborns did not get a problem from COVID at the beginning. And it is absent in old people. The process of aging is loss of bifidobacteria. We published this paper, The Lost Microbes of COVID-19. It took 8 months to publish. If you follow the bifidobacteria like I did, you will notice, and we did notice anyways, that vitamin C actually increases bifidobacteria. This is why vitamin C is important when you take care of viruses, and you've all experienced taking vitamin C for a cold. Well, we published this data where we showed vitamin C, if we give it to patients before and after, it increased the bifidobacteria. Ivermectin was also an interesting drug because ivermectin, we noticed, also increased the bifidobacteria within 24 hours of taking it. Why ivermectin? If you look at what ivermectin is, it is a fermented product of a bacteria that is similar to bifidobacteria. In fact, they're in the same continent of microbes. They're like sisters, brothers in the microbiome. So I published, I knew that ivermectin increased bifidobacteria, but I said, nah, I can't go out there and start publishing that. That's going to be too controversial. So I published a hypothesis that maybe what I was observing on the front line treating patients with COVID, noticing that their oxygen saturation was increasing from ivermectin, was basically maybe ivermectin increased bifidobacteria. The hypothesis on ivermectin was the most read hypothesis in the pandemic and was retracted after 8 months of being on. When we cannot make a hypothesis, this is not science. December 2020, at the same time that I was treating patients with COVID, I began collecting stools of my colleagues that were at home and started going into the hospital. And I said, can I get your stools before and after you get vaccinated? Because to me, this new technology of vaccines, I wanted to see what it was doing on the microbiome. I discovered that messenger RNA vaccines killed the bifidobacteria. I knew I would never be able to publish this because it goes against the narrative. So I submitted it to my college, the American College of Gastroenterology, and presented it in October 2022. This abstract won a research award at the American College of Gastro, beating 6,000 abstracts. That's from academic centers like Harvard and Mayo Clinic and MD Anderson. This abstract got the attention of 18,000 GI doctors who all of a sudden started realizing maybe killing bifidobacteria is why I got COVID after my vaccine to begin with. Worse than that, and another abstract we presented, was the persistent damage of bifidobacteria from the vaccine. What is going on here that the vaccine continues to kill the bifidobacteria? At the same time, we presented a link between loss of bifidobacteria and Crohn's disease, loss of bifidobacteria in Lyme disease, and loss of bifidobacteria in invasive cancer. It is nearly impossible to publish data that goes against the national public health narrative. If doctors cannot publish the data, they cannot find solution to fix the problems. So in conclusion, I will finish with showing this. This represents clinical trials that I've done for pharmaceutical companies prior to COVID. Amongst them are vaccine studies. Yes, I brought vaccines to the market. Proton pump inhibitors, cardiac drugs, biologics for all sorts of conditions. First postpartum depression drugs that never made it to the market because they killed people. Clinical trials doctors follow guidelines that allows the industry to provide safe drugs. These guidelines were not followed during the pandemic. And because of that, everyone is affected. COVID should have been a time where humanity joined forces together and doctors needed to come together. It's a shame that it didn't happen. Interference with research affects all of us. This should not be political. Science is a story that evolves. It's a multitude of experiments that allow us to see medicine, to give hopes to patients. Skepticism, challenging the current state of knowledge, having an open mind must be allowed if we have any hope of moving science forward. What I saw this pandemic was not science. Thank you.
Thank you, Dr. Hazan. We're out of time.
Yes.
If you want to take 5 seconds to name who you think sabotaged your research.
It used to be that pharmaceutical companies were working with the doctors. Now, unfortunately, pharmaceutical companies are captured by the price of the stock. Venture capitalists own pharmaceutical companies. They own the CRO, the clinical research organizations. They own the site. They own the institutional review board. They own the advertising, the marketing. They influence through the media. And so, unfortunately, there's it's a loaded question, but it's a big market. And what we saw this pandemic was the price of the stock mattered more than the price of a life.
Okay, thank Dr. Hazan.